Welcome, dear students. Program Bachelors of Arts, third year, subject Psychology, semester 5, paper code PSC 105, paper title Understanding Psychological Disorders. The title of the unit is Unit 3, Overview of Abnormal Behaviors. Module name, Treatment, Psychosocial Approaches to Treatment, Part 2, Module number 10. I'm Aldina Braganza, Associate Professor, Carmel College of Arts, Science and Commerce for Women, Nuvei, Goa. The outline of my module is we will be looking at 3 psychosocial approaches to treatment, and in that we will look at humanistic experiential therapies, psychodynamic therapies, and finally eclecticism and integration. At the end of this module, you'll get to understand different human experiential therapies best suited for various mental disorders. You will acquaint with different psychodynamic therapies best suited for various mental disorders, and you'll elucidate eclecticism and integration best suited for various mental disorders. Humanistic experiential therapies. Key component: mental disorders are seen stemming from alienation, depersonalization, loneliness, and failure to find meaning and genuine fulfillment. Lack of freedom to choose and responsibility to control our own behavior affects our mental health. The focus here is on self-awareness and taking responsibility for the direction of one's life. Client-centered therapy, which is one of the humanistic therapies, is put forth by Carl Rogers. Key components of this therapy are focus on natural ability of healing oneself. The relationship between the therapist and client is very important, releasing of existing capacity in potentially competent individual. The client-centered therapy uses techniques which involve the skills of a therapist, that is empathetic understanding. The therapist reflects back on what the client says and allows the client to experience his innermost thoughts and feelings. Unconditional positive regard is expressed by the therapist, where there is unconditional acceptance of the client. There is a sense of genuineness and congruence, and you accept the person to become their best possible self. This therapy works excellent for personal growth, self-actualization, and conflict management, and it forms the basis of counseling setup. The second humanistic therapy is motivational interviews. This is therapy in a nutshell. It works best as a commitment to treatment and happens in a very brief amount of time. Sometimes even 2 sessions are enough. The techniques is the skills of client-centered therapy are used again here, where the therapist uses unconditional acceptance, genuineness, and regard for the client. Therapist encourages through change talk. Summary of motivational statements are reflected back to the client, and this helps the client to strengthen and commit to change. Very well used for people who are getting into rehabilitation centers for substance abuse and addictions, and also getting commitments from youngsters, who especially adolescent problems. Gestalt therapy was put forth by Fritz Perls. Now, in Gestalt therapy, the idea is you look at the problem as a whole, because the whole, they believe, is the sum total of experiences. The unity of mind and body, there's an increase in self-awareness and self-acceptance through their techniques. They use techniques which are very creative in nature. There's fantasy play, empty chair technique, and dream analysis. In fantasy play, the person normally uses different kinds of role-playing methods are used. In the empty chair technique, an empty chair is kept in front of the client, and the client is made to have dialogue with people they might be having conflicts with. Dream analysis look at different forms of dreams and trying to analyze them from an angle of self-understanding. So it is effective with self-growth, self-actualization, and dealing with conflicting or repressed emotions. The next form of therapy, which was the foundation of all therapies, and that is psychodynamic therapy, which was put forth by Freud, and today we follow the Freudian method. Key components are that psychological problems are manifestation of inner mental conflicts. Once we become aware of the ideas and emotions that are in conflict, this allows recovery to happen. Conflict awareness helps to manage conflicts of relationships. And anxiety is a result of society and culture having inconsistent rules for the expression of sexuality and aggression. There are various techniques that are used which are Freudian in nature. The first one we look at is free association. Client is asked to say whatever comes to their mind, regardless of how personal, painful, or seemingly irrelevant it may appear to them. A couch is used to facilitate this process with the therapist sitting behind. Pre-conscious processes are examined for conflict-ridden material. Interpretation and analysis of this allows for resolution of problem. The second technique is dream analysis. Dream, according to Freud, are seen as royal roads to the unconscious. It allows us to express material that has been repressed or not available to the conscious mind. Especially unacceptable motives may be expressed as symbolic forms. When we dream, there are two forms of contents that we need to look at. One is the main content that is manifested in the dream, and then you analyze it for the underlying latent content. For example, if you dream of someone who has hurt you and you dream of that person in the form of an image, then the therapist will look at understanding the image with the latent content. What is, for example, the huge barking dog mean in your real life? The next is analysis of resistance. Here you look at topics that the person will find having problems to talk about. They could be underlying painful, threatening material which enters into consciousness. The therapist identifies this when the person will have reluctance to talk about it or change the topic every time or feel really upset when talking about that particular issue. Resistant material helps a client to confront some of the basic underlying conflicts that is the main cause of the problems that they are having. The third technique is analysis of transference. This is a very powerful technique because you look at unconsciously the transference that takes place from the client onto the therapist. And these unconscious transferences are actually transferences of dysfunctional relationships the person has with regard to the attitudes, feelings, and behaviors. It reveals central unresolved issues in clients' lives and helps the client understand the transferent dynamics. In the process of transference, the therapist must use the skill of counter-transference to help the person deal and become aware of these underlying dynamics. Evaluating psychodynamic therapy, the advantages are long-term clinical change. It helps with treating various types of mental health problems, including personality disorders, PTSD, substance abuse, and depression. These type of problems are not easily dealt with using behaviorism or Gestalt. Disadvantages is that for therapy to work, it requires many sessions. So it's time consuming and expensive. You need at least about 50 sessions before you can see results. And you cannot actually quantify results the way behaviorism quantifies results. It's very effective with substance abuse, personality disorders, stress-related ailments, anxiety, dissociative disorders, somatoform disorders. The final therapy is eclecticism and integration. The key components is basically the use of different techniques by therapists to approach a clinical problem. It includes biological, psychosocial, family, individual therapies to deal with a given problem. Techniques are interpersonal psychotherapy. They use the principles of interpersonal therapy by Harry Sullivan and Bowley's attachment theory. Effective with depression, anxiety disorders, bulimia nervosa, borderline personality disorders. The best part of eclecticism and integration is that you can tailor-make therapy to suit different types of problems. So I leave you with the second part of psychosocial approaches to treatment with questions. What was your favorite therapy and why? What therapy would work best for depression according to you? Because depression is considered to be the main common problem in India. Is medication enough to deal with psychosis, or is it important to supplement it with therapy? And I would like to ask you, if you get the opportunity, watch the movie Beautiful Mind and the Dangerous Method to understand the effectiveness of eclecticism and integration. The references I've used are Saracen and Saracen, Abnormal Psychology, and Carson Bucher Meneka, Abnormal Psychology. Thank you very much.